Hi everyone, I am Dr. C.P. Ravi Kumar. I am a consultant pediatric neurologist. I am based at Astor CMI Hospital in Hebbal and Astor Whitefield. So this video is a short introduction or a short information about MRI. MRI stands for magnetic resonance imaging, or simple way a general public know is scanning of the brain. When we say scanning of the brain, most of the times they're terrified and they're worried about what's happening with especially with the child. Obviously, that's my area of interest. And as a parent, you might have gone through this fear, or somebody might have advised you about MRI. You will have that fear. So let me clarify a few things. MRI does not have any side effects. Often people say there is radiation because they confuse it with what we call CT scan. CT scan is computed tomography. So that has radiation. It has its role, especially after accidents or traumas or some other condition, or even in emergency, we have to do CT scan. There is a huge difference between CT and MRI, but both have its role. For example, let me say about CT and MRI. CT obviously we don't always prefer, but it has its role. MRI we prefer, especially in children, especially where we need to do fine detailing analysis of the brain structure, brain or spine, or even it applies to other organs. First of all, there is no other side effect or radiation. It gives you very high quality detailed imaging. This is very important, especially when you are looking at somebody who might have had brain tumor, then the person has to get operated, so you need to get clear cut imaging. Similarly, with epilepsy, the abnormalities are usually very subtle and you cannot pick it up on CT always. In addition, MRI we can do many other things, same in CT as well. What we call angiogram, there is something called MRS spectroscopy, which looks at the chemicals. The angiogram looks at all the blood vessels. This is very much relevant if somebody had stroke. MRS, as I said about chemicals, this is very important in young children, especially in babies, if they have problems in their development, if they have problems in this problems such as seizures or anything to do with neurology or the brain functioning. This is very important because it helps us to diagnose proper way and also to obviously treat in a right way. Now, what are the challenges? I've told you the good things about MRI. The biggest challenge of MRI is the noise. The machine makes huge sound. The whole concept of MRI is based on magnetic field. There are coils which generate a magnetic field which helps us to obviously take the beautiful images of the brain. But this machine makes so much of a noise. Just imagine you're trying to sit with a mixer on both the sides. Obviously it's on. This is something even an adult finds it very difficult. And expecting a baby or a young child to lie down still when we are doing the images, it is next to impossible. The second thing is about the duration. It takes almost 30 minutes. Even for us, for me or you to stay still for 30 minutes is a challenge. So younger the child, more difficult it is. The third part is those who have seen the MRI machine or even the CT machine. It's a big hollow machine. It's like a donut and you're put inside. And if you're awake and if you open your eyes and look at it, it is terrifying. So with these things in context, if you try to do this MRI in a young child, younger the child, more the fear, more the challenges. That is where we may have to sedate the child. As a general rule, I would say any child less than 6 years, you have to sedate. But obviously some children are so bright, they understand, we can reason with them, we can get away without the sedation even in a 5-year-old, and sometimes a 10-year-old also needs a sedation. So there is no hard and fast rule. Just remember, the younger the age, more frightened they are, they will need sedation. Now, that's about how to get the imaging. When we do this imaging, many times we have to do something called contrast study. Means we give a dye through the vein, and this helps you to highlight certain areas of the brain well. It helps us to delineate the images very well. So this is very important. When we do this contrast, we need to make sure your kidney function is normal. Often the doctor would have advised you to check what we call creatinine. So it is important. This is known before we give the contrast. Otherwise, we cannot do it. Second thing is, if you are wearing, if you have any metal implants, usually luckily children do not have it, but always keep in mind if there is any implant or especially cochlear implant or any heart surgeries where they put a metal piece, it is very important to tell them. Why? Obviously, you know what magnet does with metals. It will attract, and if it is inside the organ, it can be life-threatening. The next important thing, obviously, as I said, metals and magnet, make sure there is no jewelry on the body. Sometimes we say silver is okay, some other artificial metal is okay. Better not to have it. The reason is, Even though it is not strongly metallic enough for the magnet to attract, it gives to something called artifacts. Because the magnet effect doesn't work and we do not get good quality images. If possible, go prepared, take out all the jewelries, take out all the hair studs, earrings, and that is good for you to get a good quality image. Once again, it depends on individual needs and requirements, some beliefs. So I'll let you discuss this with your doctor or the technician. Now, next important thing is there are several machines. Commonest thing, what I can tell you is there is two things. One is called 1.5 Tesla, the other one is a 3 Tesla. The 3 Tesla is of a better resolution, and these days these are norm, but it is not available in all the hospitals. We have it in Aster Hospital. The advantage of doing this, especially in some cases where we are looking for fine or very minor abnormalities, the clarity is huge. It's like comparing an old mobile phone 10 years ago, what phone you had and what you have today. That is a difference in the clarity of the screen in your phones. That is the clarity of the images we get in a 3 Tesla. So this will be really helpful for you to get a good report and good information. Now comes to the reporting. Many a times what we struggle with the parents or the patients is they want the reports instant. They've done the image, many of them they've not even dressed up, they're asking for the report. So what I can only tell you is it's like looking at your wedding album. If you have 3000 photos, there is no way you can screen it quickly and give you a report. So be patient. Sometimes patience pace. You just let the radiologist look at the images in detail and give you the report. Don't be in a rush. Obviously, in an emergency, the radiologist will give preference and he will look into it and give you the report. So that is what happens in a hospital setting or any of the radio diagnostic centers. Because there is a child or an individual whose MRI is very important or urgent, who needs the report now because of medical emergency, not because parents wants it. And then there is another one which is planned, it's not emergency, which can be done later. So that is where time is required. You have to be patient so that you get the right report. Anything when the person is looking in a rush, obviously there is a room for error to creep in. So keep this in mind, be patient, cooperate, and go prepared so that it is good for the child. Child comes out with a good experience and you also go out with a good experience, obviously with the good results that benefits everyone. I hope this information is useful and thank you very much.